Come in.
Hi, my name is Jonathan. I'm going to be your nurse for today. Today we're going to be performing a head-to-toe assessment on you. Is that fine?
Sure.
Are you in any pain at the moment?
No,
Do
sir.
I need to go to the bathroom?
No, sir.
Okay, let me just wash my hands real quick.
Go ahead.
Let me just get some gloves.
Okay.
Okay, so chest wall is the ventricular oxygen present, calculated. We feel present, okay, so I'm gonna check your ratio. Equal bilaterally. Okay, so make a certain time. For 30 seconds, so times about 12. And then the oscillation for the
So it'll be, aortic, mitral,
correct. Aortic, no, it'll be,
aortic, pulmonary.
Let me just close this door.
Okay.
Okay, if I can just look at your bracelet real quick.
Okay, go ahead.
Can I get your first and last name?
Brent Delgado,
And your date of birth?
June 12, 03.
Okay, before we start, do you know where we are right now?
In the hospital,
Okay, do you know who the President of the United States is?
Joe Biden.
Do you know what day of the week it is?
It's Thursday.
Okay, so you're alert and conscious.
Mhm.
We've already taken your blood pressure, your respirations, your temperature, your oxygen, and your respiration rate. We've taken all your vitals and they're all good. So we're just gonna start right now with the head to toe, okay?
Okay, go ahead.
Alright, so the first thing I'm gonna do is I'm gonna be checking your head. I'm gonna be checking for any symmetry. I'm gonna be checking for hair brittleness. I'm gonna be checking for any lumps or any bumps. And all looks good. Alright, we're gonna move down to your ears.
We became friends like instantly.
I'm just gonna be looking around to make sure I don't see any redness or any drainage. I'm gonna pull
So
back.
everybody was like, oh yeah.
Make sure you don't have anything in there. Let me look at the other one.
Oh, you don't know that? I was like, yeah. I was like, oh yeah, that's your
Okay.
friend.
And look behind the ears as well.
Yeah, like, yeah, that's
Okay, you're good on this one. Okay, here's what's gonna happen. I'm gonna stand right behind you on this side, and I'm gonna need you to close your eyes. I'm gonna repeat. I'm gonna say a couple letters, and you can just repeat right after me. Okay?
Okay.
Okay. If you could just close your eyes.
Yeah, you know I got you.
If you can repeat what I just said.
1, 2, 3.
Okay. I'm just gonna go to the other side real quick.
Okay, you got it.
1, 2, 3.
Okay. Thank you. So your cranial nerve for your auditory is fine. I'm gonna go and tell me if you can feel me pressing on your forehead.
I feel it.
Okay. On your cheeks.
I feel it.
On your jaw.
I feel it.
Okay, so now I'm gonna need you to open and close your mouth. Alright, now close. Okay, so cranial nerve 5 is good. Let me see, let me test you for your temperature on both. And on
Okay, so now I'm
your
gonna
legs
go
as
ahead
well.
and check your cardiovascular.
Okay. I also checked for any moisture, you're completely dry. I'm gonna look and see if I can see any swelling. I'm gonna press down on your wrist to make sure there's no edema.
So your chest wall seems to be very symmetrical.
And as well as on your ankles.
I'm
make
going
sure
to ask you to give me both
there's
of
no
your hands.
edema.
I'm going to check your radial close bilaterally.
Okay,
So what that
and
means, I'm just
let me
gonna
see,
kinda
your
listen to
pigmentation
both
seems
at the
fine,
same time.
no bruising, no
So
blotching,
I
and
know
I
the
see
radial pulse is going to
no abnormalities
on
at this time
the
on your
side of the
skin,
thumb.
okay?
Okay.
And
Alright,
I
so
have
we've done your
already
head, we've
checked
done your ears, and now we're just gonna move on to
Okay. So go ahead and just
your facial nerve. So what I'm gonna need you to do for that facial nerve is I'm gonna need you to smile. I need you to frown, pout, close your eyes, wrinkle your forehead. Alright, and then just puff out your cheeks real quick.
Now I am going
Okay,
to.
so your 7th cranial nerve for your facial is fine.
Of your chest wall.
Now we're just gonna move on to your eyes.
They're gonna be put on my stethoscope.
So I'm gonna need you to look at me, look up. I'm gonna look at the sclera to make sure it's white. I'm gonna look at your conjunctiva to make sure it's pink. There's no redness, there's no drainage, no yellowness.
Okay.
That indicates sign for
So
jaundice.
I'm going to
I'm gonna
listen
also
to the
look at
patient's
this time.
aortic.
Make sure, tell me if you feel any
Aorta?
tenderness.
Nope.
Right now I'm checking your frontal, and now I'm not checking your
The
maxillary
patient's pulmonic.
sinus. No pressure, no tenderness.
No, sir.
Okay. Alright, so right now I'm gonna be taking out my
Okay.
light.
I'm going
I'm
to
gonna be
listen
checking
to.
your
Is it okay if
your
I touch
eyes
you right
for
there?
accommodation
Okay, I'm gonna
of
listen to the patient's
the light.
tricuspid.
So okay.
What's the mnemonic that they
Okay.
taught you?
And now I need you to look straight over there for me.
Okay.
Now I'm gonna be checking for your
Yes,
corneal reflex, making sure
Yes,
that the light
all
is in
people,
both
all
sides
people, all
at the same
people enjoy
place.
mags,
Okay.
time
Lastly, I'm
magazine.
gonna of course
Yes,
I need you to look at my finger. Do not move your head, just follow me.
Herbs
No,
Point?
all people enjoy.
Yes, and that's Herbs Point, you just said it, but where is that? That's where you write here?
Yes,
Oh, okay.
yes, yes, that is correct, that is correct. So,
Okay.
I'm
So
checking your tricuspid.
we're gonna be using the Snellen chart to be able
I'm
to
checking
check
your
your
herb.
second cranial nerve on your eyes. Okay, it's all good to go. So we checked cranial nerves 2, 3,
I'm
4,
going
and
to
6
check
on
your
your eyes.
mitral.
At this time, I'm gonna be needing you
Your
to
mitral
cover
is
one eye, but don't
also
close it.
known as your apicipes.
Okay, look straight ahead at that picture and focus on it. I'm gonna be checking your pupils for any jumping or any problems fixating. Okay, if you can switch for me.
And. it is your
Perfect.
mid-clavicular
Alright, thank you.
muscle is, your
So now we're gonna go down to. Now we're gonna go
fifth intercostal.
and be looking right here.
Okay,
Alright, I'm gonna be
So I'm
just
gonna
keep
have
following
you
my
go
finger. We're
ahead
gonna make sure
and-
it accommodates to you looking at nearsighted
Uh-huh.
objects, and make sure that you can go cross-eyed, and that's called
You're so
convergence
good.
of axis. Okay.
you're like, oh,
Alright, so now I'm gonna be checking your nose.
bro.
Alright, just look up for me.
This keeps closing. I
Okay,
don't
I'm
know
looking
why
at the
it's
external
closing.
nares to make sure there's no redness, no draining, or any abnormalities. I'm gonna pull up your nose real quick. I'm gonna look at the inside to make sure there's no deviated septum and there's no blockage or any drainage coming out. I'm gonna need you to close your eyes real quick.
Okay.
Okay, so I'm gonna need you first. Put one. You can open your eyes. You can put one finger over a nostril. Sniff in. Now switch. Can you breathe clearly through both?
Yes, sir.
Okay, so there's no obstruction. All right, now I'm gonna need you to close your eyes. Cover one nostril again.
Right, you're right.
Do a pop-up
Can you
say
tell me
I
what
would
you can
also
smell?
use S1, S2.
Alcohol.
Okay, now if you can switch nostrils.
Okay, I'll do that.
Can you tell me what you can smell?
Alcohol.
Okay, so your first cranial nerve for your nose is fine. You can smell perfectly. Nothing in your nose. We're gonna move on to your mouth. Okay, so I'm gonna be looking at your lips to make sure there's no cracking, there's no injury, that there's a proper moisture, they're not dry or cracked. Okay, can you smile for me? Okay, I'm gonna be looking at your teeth. Open up. Okay, let me just get my light. I'm gonna be looking for any missing teeth, any cavities of the sort. You should be fine. Okay. Can you open up one more time? I'm gonna be looking inside at the oral mucosa to make sure it's all the right color. Now if you can just stick out your tongue like this. Okay, now say ah. Say it again. Okay, I see that the uvula is midline and centered, and when you said ah, it went up, so your cranial nerves 9 and 10 are fine. 12 is also fine because you sticked out your tongue, and it came out straight.
Okay,
So that concludes your mouth. Now I'm gonna move on to your lymph nodes. Okay. So I'm gonna start right here. I'm gonna start with the pre-auricular. Then I'm gonna move on to the post-auricular, posterior auricular, your occipital lymph nodes. You let me know if you feel any tenderness, okay?
Okay.
I'm gonna look at your submental. I'm gonna look at your submandibular. I'm gonna look at your jugulo-digastric, superficial cervical, deep cervical, posterior cervical.
I'm going to osculate your bowel.
And if you can just hunch your shoulders for me real quick. Okay?
No. I have to.
and your superficial clavicle. So all your lymph nodes, did you feel any tenderness at all? I felt no inflammation, so your lymph nodes are fine.
Okay, yeah.
Okay, so we're gonna be checking your neck now. If you could just look that way.
Which is
Okay, I see jugular vein distension. That's perfect. Now you can look this way for me. Jugular vein distension, you're fine. Okay, thank you. I'm gonna be checking your carotid pulse real quick. If you just look up a little for me.
Here, and then here, and then here, and then I'm
Okay, and then let me check the other side.
Okay.
Also take before that.
Yeah, I'll take before that.
Okay, perfect. I'm gonna make my way down to right here. I'm gonna be checking for any tracheal shift. Okay, it all seems midline. Your thyroid is not enlarged as well. Okay, now I'm gonna need you to do something for me. I'm gonna need you to just shrug your shoulders. Okay, come back down. Alright, now push against me. Perfect. Now look that way. Okay, now look my way. Okay, now push against my hand.
So, how are you feeling?
And the other way as well.
Alright, awesome. So,
Perfect. And your nerve 11 is intact. There's nothing wrong with it. So now, I'm going to auscultate your neck for Brutes, alright? So I'm going to be making sure not to hear any, using the bell and the diaphragm. I'm going to be making sure I don't hear any turbulence or any whooshing of the
So let
sort,
me ask you a
alright?
question. When was your last bowel movement?
This morning.
Okay, great. This morning. And when was your, are you experiencing any type of pain or tenderness in this area?
No, ma'am.
Okay. And when was your last void?
This morning.
Okay, and on the other
So
side,
you did a void this morning. That's awesome. So
at the
I'm
jaw,
going to
the
go ahead
angle of
and
the
let me
jaw,
just kind of, are you okay with me lifting up your shirt a little bit?
mid
Okay,
cervical,
I want to go ahead and inspect. I
and then of
want to
course
just
the
make
base
sure
of your
that
neck.
there is, okay, so your skin is matching with your.
Okay, there's no whooshing and no turbulence going on in your neck.
Okay, there's.
Now we're going to move on to
Okay.
your respiratory system, okay? So if you could just sit up a little for me. I'm going to inspect your thoracic cage. I'm looking for any lesions, any bumps. I'm making sure I'm noting any respirations. I've been noting them throughout the entire exam. You haven't had any shallow or deep breathing. Now I need you to sit up again for me real quick. Okay, I'm gonna need you to take a deep breath for me, okay? Okay, I'm looking for symmetrical, one more, respirations. Perfect. Okay, so now I'm also looking for your AP diameter, meaning that your chest isn't so wide, meaning that's signs of barrel chest, which can lead to complications in the respiratory system, okay? All right, so now I'm gonna get to the palpation. I already did the palpation. I'm gonna move on to the percussion, okay? All right, I'm gonna be giving little small bumps right here, and I'm gonna be listening for the correct sounds, okay?
Okay.
On the other side.
Okay.
And I'm gonna work my way down, okay?
Okay.
Through every intercostal space.
Okay, good. Okay, so now I'm going to do some palpations, okay? Let me know if you feel any type of pain at any moment. So I'm going to do some light presses on
I'm gonna put the
your
side
abdomen,
rail down real
and
quick,
then I'm
okay?
going to
Okay.
follow behind with some pressure, okay?
Just so I can percuss a little better.
All right.
So I'm also going to do the right lower quadrant, work my way up to the right upper quadrant, the left upper quadrant, and the right lower quadrant.
Right here.
Are you experiencing pain?
Okay, I'm gonna move on to the auscultation section, which is I'm gonna use my stethoscope to hear the breathing, your breathing sounds, okay? I'm gonna disinfect this real quick.
Now I'm gonna do some deep palpations, okay? Okay.
Make sure it's not cold.
Okay.
Perfect. All right, I'm gonna be listening for one full respiration at each side, okay?
Okay.
So, the patient has no pain or tenderness, and the abdomen has no lumps. And, alright, and the consistency is soft, and the surface is very smooth. Okay, so now I'm going to get ready to go into your musculoskeletal.
Hello?
Give me.
This is she. No, thank you, have a lovely day. What?
Okay, so, I'm gonna teach you.
No, I'm over this.
Alright, now I'm wondering.
Okay, perfect. So now I'm just gonna auscultate the front of you, okay?
Okay.
Alright, so I'm just gonna start right here at the
So,
first, right here.
Alright, so, the musculoskeletal, right?
Mhm.
Okay, help me. What I'm doing.
I'm just literally going, alright, I'm gonna do, I'm only doing one side for the exam right now. But in this situation, you just do one side, so I'm gonna do range of motion. I'm gonna have you follow what I do with your arm, down, extension, flexion, all of that.
Alright, perfect. So we're done with your respiratory system. We're gonna move on with your cardiovascular system, okay? So I'm just gonna inspect your chest wall to make sure I don't see any heaving, any thrills. I'm not seeing any lesions or anything on the chest wall. I'm making sure everything's the right pigment, everything's the right color. Okay, now we're gonna move on to the palpation section. If you can just, I'm just gonna go here at your fifth intercostal space in your midclavicular line, right here. I'm right here with the palm. I'm checking for any
I'm going
heaves,
to go ahead, I'm gonna test your musculoskeletal.
and with the base of my finger, I'm
No,
checking
not yet.
for
I'm
any
just-
thrills. Perfect.
What am I?
Okay. So now we're gonna move on to
I'm inspecting the joints.
your pulses.
Everywhere.
That's why I'm one
Alright,
side that we're
okay.
focusing
So we're gonna be checking your radial.
Alright, and then I'm gonna do the range of motion, so I'm gonna have you lift your arm up
Perfect. And then right here,
and down.
check this one again real quick.
I'm gonna have you lift your arms
Alright,
up and
perfect.
down. I'm gonna have you
Got it.
flex the knee and the elbow.
Okay, on the
So
other
that's
side.
just this, and I'm gonna have you flex the knee and elbow.
Perfect.
And then I'm
Anything here?
going to ask the patient.
Beautiful. That's
That's
good.
it.
Alright, and then we're gonna be going to your
Oh,
dorsal.
Yeah.
I mean to your plant, your front.
Okay,
Here too.
okay. You alright? You could just.
We're gonna be looking at the dorsal tibial. And I can hear.
So now I'm gonna go ahead and I'm gonna test your musculoskeletal tissue.
Okay, and lastly, we're just gonna do your brachial pulse, okay?
Um,
Which is right here.
Girl, musculoskeletal tissue.
Okay, you check all your pulses, now I'm gonna be looking at your fingers. I'm gonna be making sure
Alright, so I'm
that there's
gonna go ahead
proper
and test your
capillary
musculoskeletal
refill. You see how the
tissue,
blood
okay?
rushes back into
Oh,
your
no.
fingers.
It's
Making
okay.
sure that happens
Let me go ahead and
before
give
3
you 1
seconds.
second.
I'm gonna do your feet as well.
Let me,
Perfect. Okay, so now we're gonna move on to the auscultation. I'm gonna be checking first the point of moist impact. That's where your heart is the loudest. If you can just turn this way real quick.
Where the charger at?
I'm looking for any abnormal heart rhythms or any signs of any murmurs, okay?
Alright, you ready?
Okay, perfect. Alright, now if you can sit up straight, I'm gonna check that one more time.
Okay. Now I'm gonna go ahead and check your musculoskeletal.
Perfect. Now I'm gonna be checking your valves. I'm gonna be starting with your
Make sure your joints are intact, okay?
atrial.
Alright, perfect. So.
Right, actually, no, it's right. Second intercostal space, right here.
I don't see any
Move to the other side. That's gonna be a
or
pulmonary.
any discoloration. Your color is matching with your ethnicity.
One down. That's gonna be your herbs point.
The texture is normal and inappropriate.
One down.
There's
That's
no
gonna
edema.
be your tricuspid.
Okay, everything seems to be.
And then I'm gonna go right back here to where we took your
Are you
apical pulse.
experiencing any type of pain or anything?
And that's gonna be your mitral.
So what I'm going to do is I'm gonna ask
Okay.
you to
Now I'm
raise your
gonna
arm.
need you
I'm gonna
to
just focus on one side for now.
get on the left leaning position again.
On one
If you
side
can.
of the patient for now. So
I'm
going
using the
to
bell.
have you go ahead and raise your, we're gonna focus
And
on
we're
your
hearing
left
for
side,
any
okay?
heart
Raise your
murmurs
arm up.
or any whooshing or any
Alright, perfect,
turbulence,
and raise
okay?
your arm down. Okay, do it for me one more time, up and down. Now I'm gonna ask you to flex your arm, so I wanna
Okay,
see your
perfect.
flexion of your elbows.
Alright,
Yes.
so Now we're gonna go and check your genital urinary. So, I looked at it. There's no, your skin's intact. There's no skin breakdown. Now I'm just gonna ask you a couple questions. Have you had a bowel movement today?
Yes.
Okay. Did you have any pain or discomfort?
No, sir.
And have you voided today? Have you gone to the bathroom to pee?
Yes.
Any pain or discomfort?
No.
Okay, I'm noting to make sure there's no distension of the bowel. And now we're just gonna move on straight to your gastrointestinal system, okay?
Okay.
So I'm gonna be looking at your abdomen for any distension, for anything out of the ordinary. I'm noting any stretch marks. I'm noting any bumps, any any bruising. Okay. And now we're gonna move on to the auscultation of the gastrointestinal system.
Okay, so now I
Alright.
am going
So I'm gonna be using my diaphragm first.
check
And I'm just
your
gonna be listening for vowel sounds, okay?
pulses
Okay.
and your
I'm gonna start with the
tibial pulses, and
right
they should be
lower
at 2+,
quadrant.
for it to be normal. And, I will be checking the patient's capillaries of the toes.
Then your right
to make
upper
sure
quadrant.
that There are intact for each toe. Okay,
Then your left upper quadrant.
That's it. Now
Then your
verbalize.
right lower,
That's it.
left lower
Just-
quadrant.
yeah, okay, 2+ pulses on the tibial
Okay.
and.
So now I'm gonna be using the bell, and I'll be
And
listening
I'm
for any
gonna have
vascular
the
sounds,
patient
okay?
lay down,
So first I'm gonna
lower the
be
bed,
listening to your
I'm gonna
femoral artery down here in the lower quadrant.
Okay, so there's 2+ pulses on
Then we
each
go up here. We're
toe,
gonna be listening to
each
your
tibial.
iliac artery.
Okay, and then, do you have any questions?
Up here we're gonna be listening to the renal.
Okay, I know this is a pretty long assessment. Okay, great, so.
Right here in the
that
center is your
actually
aortic.
concludes our head to toe assessment.
Okay.
So what I'm going to do now is just
Then
gonna
left
have you
renal.
lay down, I'm gonna have the patient lay down. I'm
Left
going to
iliac.
ask the patient if there's anything else that they need from me.
And lastly, left
And I
femoral.
am going to put the patient's, lower the
Okay,
patient's
perfect.
head. I'm gonna put the palm
So
of
there's
the
no
patient,
signs of any
and
roots or
I am
any
going to
anything wrong with your arteries.
allow
Now
the
we're gonna be
patient to
moving
lie
on to the
in my
percussion section of your gastrointestinal system. This is gonna be the same thing I did to your respiratory system, okay? So I'm just gonna start right here in the right lower quadrant.
Let's do this.
I'm ready. You ready?
I'm ready. Let me see if they have a Band-Aid,
Making
cause
sure
I am
it's
bleeding.
drum-like, no excessive dullness. Perfect. Now we're just gonna go to the palpation section, okay?
Okay.
So I'm just gonna be pressing down. You let me know if you feel any tenderness or pain, okay?
Sure.
So I'm gonna start lightly, my 4 fingers, move it around. Nothing?
No, sir.
Okay. Now we're gonna go to your right upper quadrant. Okay. Left upper quadrant. And left lower quadrant. Alright, now we're gonna be doing deeper palpation since there was no tenderness, okay?
Okay.
Alright, so I'm gonna go a little
I'm
deeper.
gonna put on gloves, cause I don't want you touching my blood, because I'm bleeding.
Nothing
That
here.
is not because.
Here. Left upper.
Look at the paper, I have to check paper. Yeah.
Perfect. Okay, so everything checks out with your gastrointestinal system. Now we're just gonna be doing your musculoskeletal, which is your muscles in your skeleton, okay?
Okay.
Can you just sit up for me real quick? If actually you could just you can hang your legs over the bed. Okay, so first things first, we're gonna be looking at your jaw. Okay, if you can open. Okay, I'm gonna be touching your masseter muscles. Any pain, tenderness?
Nope.
Okay, open against resistance. Okay, perfect. Now your shoulders. I'm gonna be touching your clavicle and then moving on to the rotary cuffs. Any pain?
No, sir.
Okay, I don't feel any swelling. Alright, so shrug your shoulders.
You are wearing gloves.
Okay, go down.
Everyone's putting on gloves.
Okay, perfect. Now
Our
your
checkout
neck.
sheet says verbalize
You're gonna have to
your-
turn that way.
Alright, let me do it.
Turn this way. Okay, try to touch your chin to your shoulder. And then this way as well. Now you can do chin to chest. Perfect. Now we're gonna do all that against resistance, okay? So just push against my hand. Okay, perfect. Push against my hand. Okay, now push against my hand. Perfect. And now try to touch your shoulder again with your chin. Perfect. And then here as well.
I know you're worried about
Perfect. So you performed everything against resistance.
No, it says verbalized. Right.
Okay. Any pain or anything
I got
going on
you.
with your shoulders?
No, sir.
Okay, so if you can just put them straight forward for me. Okay, perfect. Back down. All right, now push against me. Perfect. Okay, now I need you to adduct. So it means going towards your body. Okay, with the left arm first. Okay. Now adduct. Outwards. Okay. Now up.
somewhere.
And down. All right, now if you can just do a big circle for me. And now the other way. Perfect. Okay. So now if you can just put your arm towards yourself again. All right, now push against me. All right, now put it out. Bring it back in. Perfect. Now up. Down. Perfect. All right, now let me do this shoulder as well. So out. All right, in. Inwards. Okay, now up. Down. And circle portion, please. The other way. All right, perfect. All right, so bring it in and go against my my resistance. Perfect. Now out. Perfect. Up. Perfect. Down. Perfect. All right, so that we're gonna move on to your elbow. Okay, so if you can just flex it for me. Okay, now if you can extend. Okay, now if you can go like this with your hand. Perfect. Any pain?
No, sir.
Okay, I'm gonna be touching the bony prominences of your elbow. Any tingling? Anything going on? Okay, perfect. Okay, so flex against me. Extend against me. Okay, perfect. And now this one. Flex. Extend. Perfect. If you can rotate. Perfect. Okay, so now flex against me. Okay, push against me. Okay, supinate again. Alright, perfect. Alright, so grasp my hand as tight as you can. Perfect. Okay. So now I'm gonna be looking at your ligaments and your tendons here in your fingers. Anytime you feel any tenderness at all, you let me know, okay? I'm looking for any signs of osteo or rheumatoid arthritis, meaning that there's swelling in your joints, okay?
Okay.
Alright, you let me know if you feel anything at all. You feel anything?
No, sir.
What about here in your wrists?
No, sir.
Okay, so you just bring your wrists up and down.
Can I come in? Is now a good
Perfect.
time?
The other one? Okay, so now what I need you to do is touch your thumb to every finger. We're gonna be looking for the motor function. And lastly, we're gonna be looking, I need you to make a fist. Open up. Any pain?
No,
Okay,
sir.
so now we're just gonna be looking at your wrist. So if you can just go like this for me and press down very lightly, a little harder. Okay, you feel any pain?
No.
Okay, now we're gonna be looking for Tinel's sign. So what I'm doing here is I'm pressing down on your nerves in your wrist. Do you feel any pain? Do you feel any prickling? Okay,
No,
when I
sir.
do this one. No pain, no prickling? Okay, we're looking for signs of carpal tunnel, okay?
Okay.
Alright, so if you could just stand up for me. Okay, I'm gonna be looking at your balance. Okay, you're good. Your hips are parallel. Your ankles are not swollen and they're not they are parallel. So if you could just look that way for me. I'm gonna be going down your spinal.
Can I have your hand?
Okay, your spinal. It was all straight. There's no signs of scoliosis. So if you can just turn like this and then turn like that. Alright, perfect. You can just lay down on the bed now. Thank you so much.
Mm-hmm.
Alright, so now we're gonna be looking at your hip. So I'm gonna be bringing up your knee to your chest, okay?
Awesome,
Okay.
so
Alright.
I am going
No,
to
yeah,
check my
I'll
patient's vitals.
Put it right here for you.
And I'm going to let the patient, check her
Any
blood
pain?
pressure,
No, sir.
her
How
blood
about out?
pressure's within
No.
normal
In?
limits, her
Okay.
respiratory rate
This
is
other one?
within normal limits, her
Any
heart
pain?
rate is within
No.
normal
How
limits,
about
her
out?
SpO2 is
No.
within
In?
normal limits, her temperature
Okay,
is
now I
within
want you to go and push against
and
me.
she's currently in no
Okay,
pain.
now out.
So I'm gonna go ahead
In?
and start the assessment,
Okay,
are you
perfect.
ready?
And same with this one.
We're doing the
Up.
head to toe, right? You said?
Yes,
In?
the head to toe
Out.
assessment,
Okay.
and just to
Perfect.
verify
Okay,
no
so now we're
allergies
just
or
gonna move on to
alcohol
your
tags,
knee.
Okay.
and no medical
Okay,
allergies.
so any pain?
Alrighty, so
Yeah, I'm not
I'm
feeling
gonna
any
start
swelling.
by
Okay,
having you go
so I need
ahead
to extend.
and close your eyes for me.
Okay, now flex
Do
it.
you want my glasses on or off?
Perfect. Okay, now extend against me.
You can leave them on
Or
for
just
now,
extend
and
it.
then when time
Okay,
comes,
now
I'll have
flex
to take
against
them
me.
off. So go ahead
Perfect.
and close your eyes
Alright, now
for
same
me.
here.
Tell me what
Extend.
you smell.
Alright, now flex.
I smell like rubbing
Okay, now extend.
Okay, excellent.
Perfect.
So just checking
Now,
one of your
flex.
cranial nerves.
Perfect. Okay, now we're gonna move on to your ankles, okay?
Okay.
Alright, so for your ankles, do you feel any pain at all when we palpate them?
No.
What about on this one?
No, sir.
Okay, I see no swelling at all. So if you can just go forward, like pushing on the gas brakes on both of them, just like that.
That's fine.
Okay, now put them back up. Okay, now out. In. Like this. Perfect. Now if you can just spread your toes. Okay, now ball them up. Perfect. Okay, so now out. Push against me. Okay, now in. Push on the gas. Okay, now up. Same here. In. Out. Push on the gas. And then up. Alright, now you're perfect. Your musculoskeletal system all checks out. Now we're just going to be moving on to your neural. Okay. So we're gonna be moving on with strategia.
Feel this?
Okay, so the first thing is I'm gonna be drawing a letter on your back.
Okay.
Alright, you tell me what it is.
Okay.
I'm gonna have you go ahead.
The letter
and
A.
Yes. Okay. Now it's no, that was,
Left and right.
and now we're gonna be looking at.
Put it
I
back
think it's
in there.
strategia.
Let me have you go ahead and stick out your tongue.
I know it's strategia.
Open your
So
mouth real wide
I'm
and
gonna be
say,
giving you an
"Ah."
item, and you're gonna tell me what it
Go
is.
ahead and
Okay.
swallow
Okay.
for me.
So what is this?
AirPods.
I'm gonna have
Okay.
you cover one
What is
ear.
this?
Okay, and
iPhone.
Okay. You're able to recognize
Just gonna tell me
normal
what I whisper to you.
items.
Okay.
Okay. I've already done your
Banana.
alertness. I
Okay,
want to ask you
the
those
other
first three
ear.
questions at the beginning.
Mm-hmm.
Okay. Now we're gonna make sure we did all your cranial nerves.
I love
So
it.
I looked at
Love it.
one, which was your nose.
They're
Two,
both bananas,
3,
which is great.
4, and 6,
Okay,
which were
so
your
I've
eyes.
just done
Okay.
your,
5 was your
cranial
jaw.
nerve number
Okay.
8, I did your
6,
cranial nerve number
like I said, was your
5,
eyes. 7 was your
I
facial
did
nerve when I touched you and I told you to make those faces.
7. So
8
I'm
was
gonna
your
have you go
ears.
ahead and
9
sit
and
up
10
for
were
me,
inside your mouth when I told
and
you
then
to say
scrunch your
ah.
face up like you said
11 was
lemon.
when I told you to push
Pucker your
against me.
lips.
Mm-hmm.
And 12 is when I told you to stick out your tongue.
Yes.
So all your
And
cranial nerves
then
are
I'm
fine.
gonna have you-
Your
I wrote down
neurological
number
assessment is
9
fine. You're
and
alert
10
and ready to
because I
go.
had you
Alright, so I'm just gonna put
swallow
the side
for
rail
me
back
and
up.
say, "Ah," so now I'm gonna do number 11.
And let me
So I
put
want
that
you
one
to
down.
Shrug against my resistance.
Okay.
Okay, a little harder, please.
Because we can only put.
You can do. Alright.
I can try one more time.
Alrighty, go ahead and put your shoulders up for me then.
Okay.
And then push against me. Much better. Try to resist against.
Alright, do you need anything? Alright, you have the call light.
And so I
If you
checked
need
number
anything
11,
else, if you're
checked
feeling
number
any
12,
pain, you
I'm
let me
gonna
know,
be
okay?
doing,
Sure. Alright,
3,
thank you. You
4,
have a
and
great
6
day.
at the
You
same
too.
time when I do your eye exam.